This should not have happened.
Part protest, part memorial. In Moncton, dozens have taken to the streets to voice their anger about the death of a man in an emergency room.
And the government should be held responsible.
CBC News has agreed to only use his first name, Mohammed, to protect his family's privacy. He spent 5 hours in the ER with chest pains, allegedly warning staff he thought he was dying. He left a wife and 5 children behind.
He was a very nice, sweet guy. I know him personally, and ever smiling. Whenever he will come in the mosque or you see him in any event, always smiling.
Friends from his mosque say they'll do what they can to make sure no other Canadian suffers the same fate.
I want to request all Canadians to come forward and raise their voices against this healthcare system which is failing.
New Brunswick authorities have launched a review into what happened to the man at this hospital, but Moncton is not the only place in the Maritimes experiencing crises in emergency rooms. New Brunswick health authorities are investigating the deaths of 4 people in emergency rooms since June.
Critically ill patients at our main ER were waiting over 10 hours for care.
While lawmakers in PEI and Nova Scotia have raised alarm bells over critical ER overcrowding.
I believe that the current crisis is the worst out of all of Canada.
Bianca Gallant says her doctor told her she cheated death.
He said I was literally minutes away from death, and I was one of the lucky ones, and I was lucky I was alive.
Last month, she went to another Moncton ER with stomach pains. She waited 14 hours. She says doctors found massive internal bleeding requiring surgery. She says the whole ordeal left her traumatized.
I'm scared that if one of my family members have to call 911, that I won't have an ambulance show up. I'm living in the most extreme fear.
So, Kate, I think if we look at the rest of Canada, New Brunswick's ER problems are not necessarily unique, but how is it planning to tackle them?
Well, Adrienne, you're right. ERs across the country are swamped. We've been hearing similar stories in Nova Scotia and Prince Edward Island. There are just not enough doctors and nurses. And also there's an aging population and a swirling cocktail of viruses. Now, the New Brunswick government says that it is working to recruit more people. It's also working to make its healthcare system more efficient. But it does warn that there is no quick fix for this problem.
All right, Kate McKenna, thank you for this.